All right, it is 9:01, calling this meeting to order. We're gonna just do some changes in the new business section just to move our financial update up to the top of new business later on in the schedule. Any other request changes? No, anyone? All right.
No.
Can I get an approval or a motion to approve the August 8th meeting minutes?
I move we approve the August 8th meeting minutes.
I second.
Any discussion? All those in favor say aye.
Aye.
Aye. Assuming you're.
Aye.
I don't want to assume.
Yeah.
Motion passes. Do we have anybody for public comment? Okay, gonna move on to, I think we can probably do the audit first since it's also in the
Yep.
realm of financials, but
So as we spoke about last meeting, we had our fiscal year 24 audit. We finally got the finalized version of it in, which is the exact same, other than it had a nice little wrapper on it. There was no findings, no issues. And I will speak with the FY 25 audit, come our administrator.
do we know when that'll be ready?
That is, we have
That's what
a,
you just talked about?
yeah, we have a generalized timeline
Okay,
for it, so.
In the next couple months.
I was gonna say it's usually done by like November-ish.
Yeah, we already have the contract signed and.
Okay. Great. Any questions on the audit?
No.
No?
Motion to approve it.
Oh, do we need,
Accept it,
oh, you need
accept
to?
it. Yeah, I
Motion,
think it's, cause it's to the board. and-
Got it.
And the state auditors involved in it.
all right, do we have a motion to accept the 2024 audit?
I move we accept the audit for fiscal year 2024.
I second that.
Any discussion? All those in favor say aye. Aye.
Hi.
Motion passes.
County commission, will also get a copy because they asked for it because. They're.
If Eddie Benitez has a copy, we all have a copy.
Right, she had, or, Mr. Bound had asked for it 12 months ago.
Him too, he's good point of contact and stuff.
Okay, all right, we will move on to new business. We'll start actually with Amber.
All right, good morning. We'll look at July's financials first. We have an unreconciled bank balance of $525,000. We're gonna reduce that by operating expenses of $441,000 so that we are in compliance with reserve requirements by $83,000. In July, and this is gonna be equal to the fiscal year date, we had a revenue of $168,000. That is up 3% from budget. Salaries and wages, $101,000, which is right on par with budget. And operating expenses of $9,000, which is 5% below budget, for a surplus in July of $58,000. Accounts receivable is $174,000, with 33% of that being from the West Virginia Treasury. Questions for July?
Good start. Good surplus.
I know, right?
We can go into the August if you'd like to see typically
Okay.
talk about the two in aggregate.
No worries. All right. So August, 2 months at 17% of the fiscal year. We have a bank balance of $439,000. We're going to subtract operating expenses of $427 to be in compliance by about $11,500. August revenue, $70,000, less wages of $83,000, and operating expenses of $11,000 gives us a deficit of $24,000. For the fiscal year to date, so far, we have got revenue of $238,000, which is down 2% of budget. Salary so far, $184,000, down 2% of our budget. And operating expenses of $20,700, which is down 10% of our budget. For a surplus in August of $33,000. Accounts receivable is at $209,000, with 37% of that being the West Virginia Treasury.
So in August, you said the revenue is how much under budget, 3%?
The revenue year to date, 2% under
2% under.
where we should.
So where's our revenue sliding? You know,
There.
Do you help me?
Yeah, sorry. So I think,
Can I get you the right page?
here. Say. It's right here. Yeah, just a little bit on that one. Where they.
Mm-hmm.
So yeah, our private medical copay, last year to date was 3501. Right now we're at 2922. So that's just patients coming in, what we're seeing.
Yeah.
A lot of it, now too, this, we're seeing a lot of, back to school vaccines, and of course, VFC.
have we determined to sign on for the billing?
Yes, so that was something I was also going to talk with as well. So, dealing with medical management solutions, we're going to get a contract in place so that they can take over, at least the rebilling portion of it all. We, and work with our billers to, make sure that we don't have as much rebilling to do. They have the codes, they know the codes, so we're working with them to get a contract in place.
It still looks like the accounts receivable is still growing though.
Your biggest growth between the two, there was a $19,000, roughly $19,000 invoice to West Virginia. That seems to be about 30 days old in August. That seems to be one of your big differences. West Virginia did grow a little bit.
Is the outstanding 91 to 180, is that QRT one from last year, or is that the 53,000 from the state?
I can definitely pull more
That
detail.
would have been the QRT that the state is not allowing us for.
So that's one that they may end up not reimbursing, since it was submitted after the 90 days that they said.
And they did ask for, end of the fiscal or end of the grant term. Hey, what are you missing? We submitted that for that, so hopefully they provide that to us. And then Q4 of this fiscal year has been filled out too, so we see that too. Come September, for the September report.
Hopefully you have them all in your calendar, all your due dates.
Yes.
I know it wasn't your doing.
Yeah. Because this one is a very unique grant. Where the fiscal year doesn't line up with regular fiscal year. Fiscal year starts September 1st to July 1st.
And so for the one for this past year.
Yeah.
Just ended at the end of August.
Yes.
We will now be billing it next week, probably.
Right.
Yes.
The problem with that grant going forward for this, their fiscal year starts in September for this grant, is they not received from the CDC the notice of funding opportunity, so it hasn't been sent to us. Providing the service, this is since before I came, that's how it's been. This past year, we did not get the actual signed grant agreement from the state until February, so 6 months after we started providing the services, so it just so you're aware that's happening, and it's a bit of a risk. So when Congress doesn't fund this, then it's not. I suspect that's why CDC isn't sending out the agreements, because they don't know.
Is it part of the like the current congressional
Yeah.
appropriations or the?
So
Just to let you know, Dr. Reed, literally this morning had the notice of funding opportunity for that grant.
good,
Oh, good.
good. And so we're
So at least
It took
that's,
us
so
about
it's at
two-
least funded by the feds.
It's gonna take us about 2 days to send it out, because it's already that, so. It's good.
Yeah, and we may get up for days. It's more yet.
Is there a motion to accept July's financials?
I move we accept the July financials.
A second.
Any discussion? All those in favor say aye. Aye. Motion passes. Thank you. I don't know, are you also part of the payroll software system or that's separate?
They are in a way,
I can stay, try to answer any questions you may have.
we can bounce right into that, as I kind of hit last month. We've been having some issues with our current payroll software system. Pal Holiday was kind enough to reach out to us and offered two different payroll solutions for that. Myself and Wendy have been playing around with them, and we're working on making a decision kind of based on ease of operation mixed with also a cost differential. One is very similar in cost, one is actually a little cheaper in that aspect, but also comes with a little bit more of a manual entry on our end. Both actually will expedite a few other things such as onboarding for any new personnel. It will also allow us to make, the word is escaping me right now, deductions from payroll.
Oh, you mean like health deductions?
Well, any sort of deduction, so if we have to hold back for like any one reason or another, like a hold back for.
Like if there's any kind of garnishments?
Yes,
Yeah.
garnishment, there we go, garnishment,
Okay.
that's the word I was looking. Still not quite caffeinated. It will also allow us to do things like mileage, instantaneously without having the board.
Do the checks.
Do the checks and everything else.
Which software systems are you guys looking at?
So one is OnPay and the other is Heartland. Very unique, both very similar. One is a little bit more unique in the fact that they've been around a little bit longer. Heartland has, they have a little bit more, the accoutrements, so to speak. So Heartland has geofencing, where we can see where our individuals are at when they sign in. Also, they do a scheduling aspect of it, so things of if we have events coming up, we can actually schedule within that software for it, and people can block out their time and schedule in that way. OnPay is a newer company, a very smaller company, but growing. It kind of gives us more of that one-on-one work feel as well. So again, weighing those, the cost and benefits and how we feel works best for us at the time. So I will say Portland is the one that is similar to my pay.
It is very similar. Their pay structure, like your, how you pay
Cost.
for it, the cost structure, I think. The cost of it is going to be very similar, and it may even be a little bit more, a little bit less, but it's going to be pretty similar to my pay. OnPay is gonna be a different cost structure because they do a monthly fee, and that's it, I believe. I don't think they charge you for like the W-2s or anything afterwards.
They have a one flat rate for the yearly W-2s instead of a rate and then per person type of thing. Also, we can do with Heartland that, like I said, similar to my pay structure currently, so it is per payroll that we are charged. So if we have a month where it's 3 pays in a month, it's 3 times that we get charged, where my pay or the OnPay is one monthly fee. I could do a weekly paycheck if I need to for people. No changes in that pay structure. So I guess kind of weighing that out a little bit, that would be what we need versus what we can afford.
I know there's been talk over the past couple of months about moving, like kind of aligning with the county as it relates to HR oversight. And I imagine that county has a payroll system as well. I'm just curious, I don't know how far those conversations on HR oversight and kind of moving that out of the state and into the county, but if we were to do that, would they have a payroll system that we'd be able to adopt as part of that?
I'm sure that they have their own payroll system. We haven't discussed much in the way of the HR aspect with, the fact that they are exceptionally busy with the new building and getting everything going. And I'll tell you personally, I don't know how I feel about moving with their payroll software, just because it may be a little different in need than what we need. Nature of the beast of health department compared to a county organizational structure. I do hope that we can at least align with the HR section to help with a lot of the varying issues that we could face as a health department, because I'm the administrator, I'm the chief financial officer, I'm also the head of HR. It's very difficult if somebody has an issue. You don't want to come to your boss. And it alleviates some of that pressure of feeling that they can't talk to somebody. And if there is any sort of HR question, I don't have an HR background per se, and when it comes to that level of HR. So having somebody that has that background and knowledge that can really help navigate some people would be beneficial as well.
I think one of the things that you were also looking at was moving to the county's healthcare.
So we've looked at some healthcare options, that's still up in the air. We're still sticking with PEIA as it currently stands. This is an ongoing conversation that we will be doing. And like I said, that's a progressive
It's gonna
thing.
be a big issue this fall. There's, I think, a special session that's been called on PEIA.
Yes, there's a few options out there on the special session that I'm aware of. One is to completely remove any and all non-true state entities, individuals, from PEIA. Another, I think, is out there to make sure that, removal of all spouses. Another is to, I believe, make it to where if they do stick with it, that, I think individuals cover 20 or 30% of their healthcare benefit instead of what we're currently doing, which is covering all of it. And who knows, you know how legislation goes. It could be a mix of, it could be just one of them, or it could be a mix of all of them. So that is obviously something that is being recognized when we're looking at these things as well, because the last thing I want to have is us holding the bag at the end of the day. If they do something like remove PEIA from us and not having insurance for our staff, I mean, very little.
Has there been any conversation with the Board of Public Health Association or Public Health Boards, whatever, our association that represents all of the boards of health? Has there been a conversation with them about, are they communicating with lawmakers about that? And say local boards of health get kicked off PEIA, would there be a bridge for?
So
Yeah.
usually I would have already had a meeting with the organization at the beginning of the month. However, we do have a conference next week, which is probably where we're all going to be discussing more of that aspect, especially now that it is in special legislation and up there. So there have been talked about it at other meetings, but it was very much, this is the word on the street. We're not really sure. So now it being more of a realistic thing, I know that they have their own lobbyist to talk with legislation and things of that nature. So we'll find out some more hopefully next week during the conference when the administrators meet.
I don't know if you want to talk more about it during your report about the Highmark discussions,
Yes. And
Office of Technology discussions.
that was something, but I can get into that now. That's fine. We have been in discussion again. I said last month with yes. Tech advisors to kind of move away from the office of technology. We're in the process of that. That allows us to have more of a close relationship with a local organization that can help us out more readily. And be there when we need things quickly. Also, they are also the organization that is helping create the IT infrastructure for the new facility. So again, it's a kind of a win-win on our situation. We did have a conversation with, Brian, and I cannot say his last name, so Saholo, I do believe is his last name, from Highmark. He came in and discussed one of the plans and kind of what what Highmark does cover. We have a couple different options that we'll kind of go over. And one of the big things in that discussion was, a couple of the things were the copay amount, covering medications, and what medications are covered, and also, the deductible. So, there is a plan that is roughly similar that he presented, and myself after that discussion. So we will sit down some more and discuss that, see if that's
It gets very complicated because also there are other benefits, such as life insurance and optional life insurance. And then if the calendar, the year for the PEIA plan is July, and some people may have already paid into their deductible. And so if you paid into that and then you started the plan next month, then you lost that. So is changing insurances, is that something the board wants to approve or just be aware of?
I don't know that we need to be involved. I think it's, I think the objective is clear, is that if it is either equal or lesser cost and does the appropriate coverage for employees, I don't know that we need to approve a specific contract.
sure.
Anyone that has special knowledge that wants to put their 2 cents in.
I know, I'm not your insurance person.
It's funny, I try to reiterate some of the things that when questions are asked, that I ask them and reiterate, I'm like, I cannot speak insurance fees. That is a language that I can't get quite down right.
I don't think anybody can.
My daughter's asked me which insurance plan that she gets. How would I know?
Yeah, what can you afford?
Yeah.
and
It's
what you want
better, it's
from
platinum
that?
better than gold and better than silver.
Right.
Are the costs similar with Highmark?
So depending on which plan we go with, it could be lower, or it could be very similar. Again, basing off the needs of what our employees have stated, the one plan is similar. There's other conversations that we do need to have in-house about those sorts of, if we go with this very similar plan. But that they do have a very similar to lower cost, or they even have a higher cost, but let's.
Well, and it's also something to take a look at, because if that helps, if that's a way that we're able to attract or keep employees, because we can't do stuff on base pay, but
Correct.
have a better benefits offering.
Correct.
Not all employees always see that.
And I will say, at the end of the
Those
day,
that actually pay the bill do.
No, it's a good point though, and a lot of people do look at the total. And they factor in their costs on insurance.
and we don't provide much in the way of benefits due to being a health department, right? Regardless of the situation, what I want is that health insurance is, make sure that it is taking care of the people that work here, because we take care of the population. At the end of the day, the best insurance that we can get them to make sure that they are safe, they are healthy, that's what's important to me.
Well, I think access is the biggest one.
Yes.
That's one of the biggest problems with PEIA, especially where we are located. We have world-class healthcare literally within an hour's
Yeah.
drive. And we're limited, or friends of mine that have been on PEIA are limited in their access to that. And I think access, if anything, is probably one of the biggest things
Yes.
in our area, not to discredit our actual local healthcare, but sometimes you need services beyond that, or you want a choice of provider, and I think that choice is important.
That's very, very true.
That was gonna be my question. I'm sure the big difference between PEIA and the Highmark is Highmark would allow you to go out of the state, where PEIA is very limiting with that.
Yes.
Even at a similar cost with similar coverage, the benefit for us would be
Yes.
much improved.
So PIA, if you do go off and you have to go out, you have to get a referral, then PIA has to approve it. But if with Highmark, it is one of those things where they take Highmark, Right. So there's no worrying, so if there's an emergency situation where you have to go see somebody outside of the state, which would be network for PIA, there is no real delay in that, or worrying that you get a bill and are you gonna have to pay it or not.
Right.
And if you're on vacation out of state,
Yeah,
and you get sick, PA doesn't have many participating providers in Myrtle Beach or
Yeah.
California, whereas Blue
Should
Cross
have
does.
bigger coverage in Myrtle Beach, isn't that
Yeah,
where
they
like the
don't
rest
have
of the
more
state
people there.
goes?
between there and Florida, you know, it's pretty much, you know, it's West Virginia light essentially. Uh,
Right.
Signals, all those have national.
Yeah, I'm on California Blue Shield too, but it's not California.
again, those, like I said, an area that we were.
So I think that my opinion is take a look at all of it and look at it also from a potential benefits offering of,
Correct.
even if that's a way to increase what we're able to offer both existing and future employees.
And part of that is also, you know, if you compare ourselves to other employers, is some employers offer family coverage, which is a big step up, but that's a huge step. I know I've worked places where the most of the staff ended up having their kids on Medicaid because that's, you know, which is nothing wrong with that. It's good coverage, but it's also limited when you need specialty care. Even if Morgantown has just as good a care, it's further. That's another barrier. If you have to go back every week to see the specialist, that's hard.
Well, gasoline prices are dropping, so
Okay,
they're fluctuating quite a bit.
yeah, but winter's coming.
Yes, winter's
That
coming.
makes traveling to work a test.
Right.
To go back to the payroll software system, and she got away from us here
Oh.
while we hadn't really finished that. Do
Oh.
they offer a service of doing the payroll instead of doing that in-house?
So, we would essentially still be kind of doing the in-house things, making sure that the time schedules are correct, that everything going forward. They would then essentially, be the ones that cut the check and send it out to the banks, for each individual.
And I believe,
If I understood that question correctly, I apologize.
I think about 3 years ago, this was their advice to go with one of these kind of, because we were doing it in-house, and they said, this is, there are companies that do this. Unfortunately, the one we had, they had lots of gaps in their in coverage for, you know, like payrolls due today, and we needed, so, well, that person's out.
Yeah.
But it happens every Tuesday when.
Yeah.
And either one of these will, while we still do make sure everybody's, hey, we can do the adjustments that we need in-house without having to require somebody else to, hey, I need you to get on here, hey, can you do this, all of this, that, and the other, plus, even something as simple as comp time, we'll be able to take care of now. And I'm not manually, it's everybody's comp time, calling them up, saying, hey, no, put everybody at 80. I have everybody's over list. Let me calculate comp time for each individual at 1.5 and put it into the system by hand. It will all be calculated out through them, and then
Okay.
checks be cut through or sent out electronically through the bank.
The other area that this software does not, present software does not cover is travel expenses.
Correct.
And be nice to have that done electronically instead of half of the checks you have to sign are travel. Be nice to
Yeah.
do that.
Yes, it would save obviously the board members time, carpal tunnel, those aspects. So, and it allows us to take care of things. No one's waiting on their mileage for a month.
Right.
Or, you know, whatever, because we'll do it, put in for after the Board of Health meeting, they're done, but their mileage for that week. And then they gotta wait till the Board of Health meeting to round, so you all can sign a check.
Oh, we come in way more than a month.
No, I,
Just for the record.
yes, you do, and I'm not trying to
But
say
there's a
that you
delay.
don't.
Yeah.
Check.
I'm not saying that you don't.
And we still have,
Poor Wendy.
we still have oversight of the
And checks assigned today,
Yeah.
actually.
Yes, you do. I was, make sure to remind
Scissors?
you. No, I'm just kidding.
Your signature needs to be on, so for once.
Oh,
Yeah.
no problem.
So if there's ever any kind of question, you know, it's like, oh, that Karen Bailey just signs everything.
The old rubber stamp.
Yeah, auto pen.
Auto pen
Auto
failing.
pen, yeah. We don't need any auto pen situation here,
So you know, you're signing stuff in your sleep, just.
kind of. All right. Great. Anything else on payroll software or want to move on?
I'm good. I mean, if there's any other questions, I apologize for cutting that short. Apologize on that.
All right, sanitarian training licensors. I have not had a chance to take a look at the docs. I was fully intending to do that this week and then ended up having to work late every day. So my brain was fried at the time I finished, but I'll work on it this weekend and send you guys back some notes.
Yes, ma'am. No problem. And like I said, we kind of put together the discussion points,
Thank you for that.
Got Reed
Yeah, I did a quick look and.
put together a little outline as well. We have some of the rules and regulations in there for the state code. So just,
Perfect.
Yeah.
Awesome.
Kind of give
Yeah,
it-
thank you.
break down the information.
Either I or the autocorrect made one error on the second page of my notes. It talks about the sanitarium training. So it's-
Yeah.
It may as well be though.
You know, the order of the-
Oh, in one of the documents,
They're on
okay.
the forecast. However, I did send out an updated
Okay. Oh, yes,
this morning.
thank you.
Yeah.
I may need that sanitarium.
I said someday. it might
Access.
Work, you never know. It's
Well, all our friends will be there.
Right.
very, very true.
Is the idea behind this discussion points to do some advocacy to try to get them to change this, and this is kind of
Yes.
the arsenal for that discussion?
Yes, we've, with the way that the state is doing some things.
Oh, yeah,
How they do.
you made it very clear the challenges.
And the challenges that we face, especially being in one of the few areas of growth within the state that need sanitarians. Is in that is the reason behind it, is to help be the advocate for the change that's necessary in the state of West Virginia. But in line, especially with the surrounding states that we are nearby.
Got it.
Yeah, the other piece of, I mean, there are many pieces to retaining employees, but the
Yeah,
other
it was.
piece is compensation, and the health insurance is a big part of that package.
Right. Board of Health Rules, section 4.2. I'm
So I'm gonna start on my part.
Go ahead,
Okay.
please, yeah.
So. We, obviously, this is our season as sanitarians for temporary event setups. These are vendors that are coming to the county for most of the time a 1-day event. These are like your kettle corn stands, your snow cone people that serve at fairs or festivals, things like that. Currently, we have been evaluating these on the requirement that the people that are operating these stands need to go through the certified food management training, which is the same training that we require for our full service food establishments. It's a 2-day training and it is over $200. So it's a very high barrier to obtain for, a 1-day event. So I was kind of doing some research on this and I did find in the West Virginia State Code that the West Virginia State Code does exempt the temporary food vendors from this requirement. So this is kind of twofold. One, I wanted to obtain board approval to go ahead and begin following that state code. And two, I wanted to ask that we amend our local rule that puts that requirement into the Board of Health's local rules. So I provided that copy with you guys and highlighted where our local rule does require temporary vendors to have that certified manager.
So we just need to get ourselves compliant with state.
Yeah.
code. So I mean, from a process standpoint, yeah, I think we just have to follow whatever open comment period.
Yeah, yeah, we can put it out for public comment. I think you had mentioned maybe getting.
There's some other areas, yes, and there's some other, so with the rule required, and I think we may have included that in the packet, is that when we decide what we want to change, that needs to be put out for public comment, put on the agenda for words, and then it has to go to the county commission to approve it. When they approve it, then we register it with the county clerk. Now, I'm not sure if the county commission then needs to put it out for public, but that's not my worry. There's no urgency in doing this. We're just gonna follow the code. We have no choice. But there's some other areas in the,
As far as process is concerned.
no, we do that, yeah.
I will check the flow chart, which we don't have. And that's why it's so confusing to so many people, is there's a path, but, and it's defined. But the people who know stuff don't seem to be able to be willing, to put it on paper. With planning commission, for instance, I repeatedly ask for a flow chart.
What's the
A
process?
person walks into
Yeah.
the room and says, I want to do a project. What path am I following? They don't have a flow chart. And with an engineering background, the first thing I ever did was, when I looked at a document, looked for the flow charts. And they just don't have them. And that would be a great thing that we could.
So the local
Put
health
together.
department
Yeah.
rule is in the packet, references, where the county
Yeah.
commission falls in, but then I think it's blank as far as what they have to do to prove that. But there are other things in our rules that these started decades ago. So we have rules that govern how we do things in-house. And then there are other rules of how we deal with the public. This is one that how we deal with the public. So we were imposing something that's beyond the state law, and there's no real reason to keep doing that. Or some would argue authority to be able to do that. One that goes to our software
Yes,
situation is rules of travel. So we have travel expense approval. This is in the rule 212. So our rule, which to change would require county commission approval in public hearing, simply says that it's travel expense vouchers have to be signed off by a board member. Exactly.
This
But
is
I don't know
a
that
health
that,
officer.
yeah, but I don't know that that needs to be in rules that are approved by the commission. It's different than other kind of rules. We'd have to change that, or yeah, because one of us would then have to sign off stuff that I'd want the supervisor to be responsible for. And there are a number of other things in there that you say, I don't know, that we can't change this without going through the added step, which only was added about a year ago. But that's an added step to what could be a fairly straightforward process for changing a rule.
So are you asking for other changes or?
Maybe people could look at we can look at the rules and regulations as well. I'm not today proposing that, but if we're going to change others, I'd rather present them. For example, the one about the travel voucher, that could be one we also simply eliminate.
Well, I mean, we also don't want to run afoul of oversight.
Right.
Because, because we still are an agency, and so there's stuff that, while annoying, also allows for oversight and accountability within this. So I think there's a bit of a balance there.
Right.
We're not in a private entity where, it's up to the CEO to decide how they want to structure stuff. So I think we're be mindful of that.
I think the biggest thing is also looking at some of the wording and phrasing, because it is older.
Mhm.
So again, vouchers, we don't use vouchers anymore. Well, phrase that, the moving to the new payroll software, we wouldn't need to use any check or vouchers or anything else like that. So just, not necessarily removing some of these, but maybe amending the wording to be more modern into the systems that we are using. Again, it's, we're catching up with the times, and we're trying to catch up with the times here at the health department as well. So just making sure that when we do have again, it is a CYA thing, on our end to make sure that we are, regardless of, that one can come back and say, well, you're not technically doing this right.
Right.
And so we made just an amendment of, like, when it comes to the travel, saying that sign off on payments. I don't know, just saying, just to update the wording on it.
Yeah, I mean, I think anything, just like we did even with the fees review that we did, like a year ago, is existing, proposed.
Correct.
And I think in this case, existing, proposed, and what the state says.
Correct.
Right, because I think that's also something we've been trying to do is align ourselves back to the state, what the state says, because that actually is where we have to follow. So I mean, that's on your all's timeline to do that, but but the food stuff, we want to kind of start to move.
Yeah, so I did, so we've got the one that we have is section 4.2 specifically in our rule. I think that you guys have a highlighted one, but we just put that.
We've got the West Virginia State Board of Sanitarians.
And there's
Awesome.
the way I print them off, I put them all in one packet, PDF packet, and print them off to say,
Oh, here,
Violence.
it's like on the back of the end of the sanitarians.
I apologize for the printing aspect of it.
There's a lot going on in this packet.
There's a lot of rules and regulations today.
So yes, so it's under our environmental health and our local rules, policies and procedures. 4.2 is in regards to food protection managers.
Yeah, so it starts with Jefferson County Board of Health local rules, policies and procedures, like that just one.
Yeah. It's the front and back that's.
Yeah, so the back that's messing with that.
Yes, and I apologize, it
Yeah,
is, the way I end up.
Okay,
off the whole
gotcha.
packet.
We're big boys and girls, we'll figure it out. Maybe, in the sanitary. Okay, so we've got the actual language that it
This is
exists,
what we have
but do you have
currently.
proposed language?
So my proposal is that we just change it to follow the state code, which I believe should be also included 64 CSR 17. The state code reads 3.1, that it references the food code requirement, section 2-102.12. And it says that this section does not apply to temporary establishments, so it's pretty simple language. I think that if we were to amend 4.2 in the local rules, either we could just take out the in parentheses, including temporary food establishments, or we could explicitly add this section does not apply to temporary food establishments.
Well, if you want us to move on this today, we need what you want us to
Yes.
consider and approve, and it'll be reflected in the minutes. In which then you can go out to your public comment, follow your access, otherwise you're gonna have to wait till next.
My question is this paragraph, if that's already in our code, it's in the state code, why can't we remove this so we don't, if the code changes, we don't have to change this, it's simply we're following the code because we have nothing special to say.
Which is the.
And it wouldn't
which is
change the
this and
numbering
that.
because the food handler stuff stays in there.
So are you talking about in 4.2?
4.2, so
Yeah.
the whole section, food
Yeah, that's
protection
true.
managers, we just eliminate that.
4.2 doesn't, if we were to remove the temporary food requirement, it would not be any different than what's already in state code. Therefore, that would make sense to me if we just removed all of 4.2. from
All of
rules.
4.2?
Including food handlers,
I don't think you wanna get rid of
Oh, I'm sorry.
the second
just that
paragraph.
first paragraph.
Yeah, sorry, the first paragraph.
And that way there's no
just-
renumbering of subsequent things.
Right. Just the food protection managers.
But so do you need a food protection manager though in a regular establishment?
Yes, but that's already in our state code, so like, what I mean is, if we were to remove this, we would still follow state code, the only difference
Yeah, I don't like
is.
the idea of removing it versus
Mhm.
calling out that we follow state
Follow state
code,
code,
X,
yeah.
Y, Z.
Yeah,
Cause if the restaurant's going to open, they're new to the area, they're gonna pull these and say, okay, what do I have to do? And they're not gonna know to go to state code to find out all the
Right.
stuff other stuff. So either, yeah,
So is this the same as a Serve Safe, that
Yeah.
certification? Do not most people have that?
This is the manager.
it's the
yes,
manager.
for full service establishments,
Okay.
it's the standard, but for the temporary foods that are coming for a one-time, one-day event, usually they don't have it. Which is then where I have to say, well, I can't approve you to set up to sell snow cones unless you go through a 2-day, $200 course for one day. So it just, obviously, it imposes a significant barrier on our residents.
Well, coming from this side of the industry, if they're doing this and they're going from place to place, do not most of them have that certification? Because most places would require that as well. I mean, when we would cater in Maryland, we would be required to have it.
Yeah, a lot of the ones that are affiliated with a restaurant do. But if it's just kind of like a person's side hustle kind of thing, like on the weekend, I set up at fairs, usually they don't. If they're not specifically affiliated with a restaurant, usually they'll have their food handler cards.
Yeah,
That's
the
usually
food
what's
handler,
happening.
not this, it's this manager
Mhm.
one that's.
Right. But it's good for several years.
Yeah, it is good for up to 5 years.
Mhm.
And we do also recognize if you do have that, we'll still accept it, instead of having to also require you to get a food handler card. So you can kind of give me, it's still useful. But I do think that it creates a lot of problems for us. We're trying to approve the temporary vendors.
I think especially in the situation of the state does not require a temporary vendor to have one. And so in that situation, while it is a good thing to have, no doubt. Any safety measures, training is always a good thing. That's where the mix up is we're saying that you have to have it regardless when the state is.
Well, the
saying-
state's kind of saying that you have to have it in your local jurisdiction. Right, and there is a process to validate that they're square in their local jurisdiction before you would approve them here.
For a regular restaurant.
Yes,
Well, I mean,
yes.
even for the temporary, it sounds like with the reciprocity, it sounds like,
That's different. The reciprocity is the sanitarian stuff.
oh, I thought that was for the local the local.
That
Food
was.
Okay, okay. So what's the method to validate then the local vendor that they do meet? Just that they have a food handler card, that's it?
So right now, if you apply as a temporary food vendor, we ask for the manager, and then we ask for their certified food manager certificate, and then we ask for all of your food workers that'll be preparing food, and we ask for all of their food handler cards. So they have to provide us with that documentation before they receive the permit to even set up at their event. And we only require 14 days notice to apply for this, so sometimes that means rushing to get a certification with less than 2 weeks notice before the actual event itself. So it just kind of causes problems.
And then you inspect them when they set up.
Yeah.
And if they're selling snow cones, that's one thing. If they're preparing crab cakes, that's a totally different thing that somebody needs to have a Serve Safe. I mean, there's a big difference in what
Yeah.
they could be.
I mean, I think it could be worth it to consider a difference for potentially hazardous food versus like what you're saying, if you're a temporary food establishment serving non-potentially hazardous food, snow cones, cotton candy, that kind of thing.
Doing what you're trying,
Sorry.
but doing what so we're going back to the original point here is that this doesn't get rid of the food handler card requirements. It gets rid of the food protection manager, which also is for the temporary food establishment, which is consistent with state code.
Right.
State code does not differentiate crab cakes.
Yeah,
True.
they don't. But we would still require
Most
the
states would be
food
like
handler
those
cards.
Who's getting
So-
crab?
And they would still get obviously they would still get the in-person instruction from us to make sure that they're compliant. So it would really just be the actual certificate.
So would you change this to remove including to put except temporary food managers in the second line?
Yeah, I think that would be fine. Mhm.
And temporary food establishments is defined somewhere? Like in either state codes?
It's defined in state code, yeah.
Does it not need to say that? Does it not need to say what's in the state code that they need to follow to be clear?
You want to put
We can
reference CSR, whatever,
Yeah, it's 64 CSR 17 is
so
the
put that
code.
in that paragraph.
Oh, okay. I see what you were asking, sorry. Yeah, I think it pushed them to shove it, especially if we're making the amendment, we could have that in there to say per state code 64 CSR 17. Did I get that one right this time? I'll say, we've talked about it for like 3 weeks and I never get it right.
Or WV
64 CSR 17.
64 CSR
Mhm.
17.
Yep.
Okay, so it would read, so the amendment. Or we're not amending any this part, so effective August 30, 2019, whenever food is being prepared or served in food establishments, open parentheses, except temporary food establishments per West Virginia 64 CSR 17. The person in charge of the blah, blah. So the amendment is we change including to accept. And after food establishments, comma, per the statute, West Virginia 64 CSR 17, close parentheses.
Should the effective date be today?
I would think today.
Do that. Well, we don't have a motion yet, so.
Or would it have to be, wouldn't that have to be when it's approved and goes through the public comment period? Like it's effective, it's not effective until
Effective when the county
in
commission
the county commission.
says it's effective.
Yeah, so
Well, it could
there's
still be retroactively effective.
Okay, okay.
Based on your direction that you should follow the state code.
If the county commission wants to drag its feet on this, then.
So-
Or send everybody over there.
So instead of saying,
Just bring it on.
Yeah, so you're gonna have a vendor like protest going, okay,
Food fight.
snow cones
Snow
everywhere.
As long as it's not crabs.
Yeah, well, I mean, we know some people. Seek out the sun for 4 days too. Little bit of civil disobedience with some old crab cakes, see how that goes. I can just see Jack in the meeting being like, okay, here's the situation, we're gonna take care of this, because.
Do you want to read the section?
Which
And
is-
then we could, because it's being recorded, and then we'll transcribe that. You could say something.
This- Well, we're not there yet, I got this, done this a lot.
What's the question?
What do you want the effective date to be? Cause then we can go into like, so we have it clean for transcripts. You guys can write it out,
Mhm.
but September 30th, October 1st, today's date. I
if
mean, we can't really do it today's date because we have to do a 30-day, we will have to do an open comment period.
Yes.
so.
what
that
is
would
the comment
put-
period? Is it 30 days?
I can,
It's
would
30
I be
days.
able to put it out today? I mean, pending approval, obviously.
I don't see why you couldn't put it.
So that
It'd
would
still
put
be
us,
mid-month, either that or November first, we wanted the
I
first of
mean,
the month.
I think the first of the month is the best opportunity.
Yeah,
for
I think that's
everybody,
most clean.
But still, I mean, we can put it up for comment for the 30 days and that kind of allows things to hopefully flow with the county commissioners.
put it out for comment when
Next
the
board
first,
meeting is the 10th.
Yeah, that won't be the 30
Yeah.
days.
right?
The 30 days.
I'm inclined towards November first, that's
Yeah.
my take on it.
So we would put it out on the first, which would then end on the 31st, and then the November meeting.
Well, no, you can put it out before then. We're just putting an
Oh.
effective date.
Well,
Sorry.
remember,
Yeah.
we're gonna have to vote on it again after it goes through public comment. don't we put out a proposal and then you wait for the comment to see if there's any amendments and then we move it forward?
Hmm.
So we're not gonna be able to move it forward in October, it's
November.
gonna be November.
Right, yeah, that's what I'm thinking.
Dr. Reedy, since you have a calendar up, what's the first, Thursday in November?
So the first is the 7th, the second, which would be our meeting, would be the 14th.
Hmm.
That would be in time for the second meeting, if it has to go to the county commission. I just want to make sure.
Well, we won't be
have
able to,
enough time.
like, if we follow that, I mean, we can also call a special meeting and just prove it once the public comment period is finished and get it over to the county commission, because the county commission has not been.
I want to make sure that you get it in, for the deadline for, the meeting. And if you need a co-sponsor from a county commissioner, I'm your man, so. Because to get it on the agenda, you usually have to have a co-sponsor.
This won't cost them any money.
Yeah,
Oh, then they love it, they'll love it, so.
When is the October meeting?
Temp. So if you open it up on Monday, that gets you to October 15th, that's 30 days. We can always schedule a virtual special meeting to consider public comment, if that's amenable, then great, 10 minutes. And then get it over to the county commission. I don't know what your schedule is on the county commission, so I mean, we could always give them 30 days to deal with it. So we can always make this either we can keep it effective November 1st, because if it takes them, whatever, it'd still be retroactive, or you can go to just December 1st.
We want to be, make sure everything hopefully goes through smoothly, social commission and anything. And I feel like December 1st would be.
Yeah, I do
Yeah, that's
too.
fine.
I think that's a
So like
little.
December, yeah. It's good to know that they can retro it.
Yeah, but in this situation, we are kind of moving out of the busy season for the food vendor.
Yeah, it's not gonna help you much right now.
Yeah.
Sorry.
So, so this situation is one of those where it's not going to affect us.
I guess my question is, do I continue to impose this requirement, or do I follow state code pending we're making these changes?
I think you have to follow it.
Don't ask questions you don't want the answers to.
And from the prior conversations with our council here, but he feels strongly that we need to follow code, that we do not have, that our state, there are limits to how much you can make more restrictive laws at the local level.
So we'll do December 1st.
Yeah, you can't not enforce because it's pending. That's unfortunate, the case. All right, so
Are we at on the list?
We got there. It just took a little while. We
all
got
right, so I'm gonna do the motion. Chair. I'm gonna make a motion to amend section.
4.2.
I'm trying to get my front page now, just a second, I'm looking for my title page, thank you. Putting forward the motion to amend section 4.2 food workers of the Jefferson County Board of Health, local rules, policies, and procedures. To read as stated, effective December 1st, 2025. Whenever food is being prepared or served in food establishments, open parentheses, except temporary food establishments per West Virginia 64 CSR 17, close parentheses. And the rest of the language remain as is.
I second that.
Any discussion?
I think it's CSR 60-17. That what
She
you
said 64 CSR 17, that's what she told me.
That's correct.
Any other discussion?
Nope.
All been.
That's a very comprehensive. If you're waiting for a Brandon to say something, that's all.
All those in favor say aye.
Aye.
Aye. processes. I think in the future, when you do want to do any of these kinds of changes, come with the language.
Absolutely.
It's helpful.
Otherwise, we're gonna go through this painful process over and over and over
This is a
again.
learning experience. We'll have- It's a college.
Okay,
Won't have to.
so we all learn by trying.
And this aligns us more with state code and it makes it just a little bit more easy for business to do business.
Yeah.
Exactly.
We see Alexis's snow cone business pop up in December, that's why this all, it's such a big deal. All right, where's my agenda? All right, moving along to, agency reports.
See what that amount.
Environmental.
Now, we
Okay,
do the sanitary.
y'all are gonna
Yep.
sick of
This is true.
We're fun.
Yeah, so like I was saying earlier, August was our very busy month. We have the Jefferson County Fair, which I think we had a total of about 17 food vendors that we inspected as a group. It went very well. It was a really good event to get out in the community, see kind of all of our food vendors, meet a couple new ones from out of state. We had really good positive experiences. And some of the sanitarians also did staff our fair booth that we had. We decided that we were going to give out as a giveaway thermometers for like your fridge or like meat thermometers. And when I tell you, this was a hot commodity. People were coming up to the table and saying, I heard you guys are giving out thermometers. Like, I would have known that this was the draw of the event. Like,
Alright.
people were.
Why didn't I get one?
Yeah.
I want one too.
Yeah, I did look for you guys, I didn't see it.
We were all.
Have to give them out before T-Day.
And over where they, during the,
Tractor pulls, but.
We-
yeah,
they give
way
us,
past that, though, like, we were way.
It gives a questionable location
Yeah.
for sure. Next year, we're gonna try to coordinate that to be like up where like the sheriff is for the front. We were kind of in like the sales vendor
Yeah.
tent area. So, yeah, we didn't get as many people as we would like, but we did still have some good interactions with the public, I think.
An option is to be within one of the buildings.
Yeah.
The advantage of that is if the weather's difficult, we're protected and
And they have ceiling fans,
Yeah.
so it's a little cooler than it used to be. back
Was it hot
in the
this
days.
year?
Oh my gosh. It
Was that-
was like 90 degrees the first day.
I missed the first day, but the days I was there, it was all pretty reasonable.
Yeah, we
So,
went that last night and it was nice, and it was cool that I
it
did.
was
Yeah, the rest of the.
excellent weather this year.
how do we pay for those type giveaways? Where does that funding?
So this one was, when we were going through our trailer, I found like buckets of thermometers. That I'm not entirely sure where they came, like, I'm talking like buckets. And I'm like, well, we're never gonna use all these, so let's just, make them for the public, and I don't know where those came from, I'm not sure when or how those were obtained by the health department, but that's kind of just what I decided to do with them, so.
Great idea.
These are fairly low cost ones. right?
Yeah, they were just the
$1,
little,
$2.
they're not the digital ones, they're the analog probe thermometers, so yeah, they're.
Awesome initiative, kudos.
They went to use, they drew a lot of people,
I
so.
think that's something to consider for next year too,
Yeah.
because the whole point of being out there is to draw a crowd and,
Mhm.
how do you get that crowd?
Anything that's free will draw a crowd.
Yeah. And it's kind of one of those things where it's like, I've kind of find it's awkward to have environmental health conversations, because it's like, do you know the temperature of your fridge? Well, I can tell you, and so it's kind of an easier way to start conversations about food safety, and so it was a hit, so I didn't expect it to go that way, but it did.
And it's
So
something everybody needs.
it was really fun, people really liked it, so
It's neat.
it was exciting. I'm definitely gonna do that next year. I've already got the research for where to find bulk thermometer orders for next year.
I just realized I don't have a thermometer.
We can get you one.
Yeah.
We can get
We
you
might
one.
have a couple in the back.
We absolutely, well, they give away a lot of them, but I'm sure there's some lying around. Yeah, so we did do those inspections. The fair went well. We also did have a second very large event, Charlestown Classic, which takes place every year. We had, I think, 10 or 12 temporary vendors and trucks that were there. That went really smoothly. We have a really good relationship with Hollywood Casino. So they actually, we were able to coordinate us to schedule a time that we went in and inspected all of the actual facility, all of their, restaurants and bars inside of it. So we were able to get a pretty large amount of things done in 1 month, basically. So it was a good month. As we talked about earlier, we held the interviews for the open sanitary in one position. We have it narrowed down to some really good candidates. So we're kind of just mulling it over who would be the absolute best fit for the position we have open. I'm hoping to decide that and extend the offer within the next week or so. So we'll have hopefully that candidate started by the next board meeting is the goal. The fall training, sanitary training has already started at the beginning of September. So they will have just missed the boat on it, I know. So they will be going in January, is the next
It's
one.
not terrible.
Yeah, so we kind of talked about it, talked about it in the interviews. One, I think it's nice because the last time we hired, we had to immediately send them to Charleston for the first day, which is rough because they didn't even get to meet the team and everything. So at least now they'll get to really meet the team and see what we do before they have to learn it in the classroom environment. So, we'll make the best of it. But yeah, that's going on. We did have our one of the sanitarians has finally obtained his license fully. So he's completed all of the requirements.
Is that Mason?
It's John.
Oh, John.
Mhm. Yep, he's all done. Got
So
his
do you have
license.
3?
Yes, we have 3 sanitarians right now that are fully licensed.
Mason, so where's Mason standing?
He's fully licensed.
So 3 other than you.
Correct. Yep. So we have the 3 of them, and that's pretty much all I got. I think it was all cut.
Have the permits slowed down? I haven't there.
So our permits, yes, we're issuing a little less than our 12-month average on permits. But what we're seeing is an increase in the amount of final inspections we're doing. So all of the rush of those permits are finally being installed. So now we're having to actually go out and double and check that they installed it all correctly. So that part is a little bit easier to do than the site evaluation and permitting process. So yes.
Anything else for Alexis?
A lot of general sanitation inspections.
Yeah, so John and Brandon both were doing OJT for their general section. So that had to specifically be hotels, childcares, mobile home parks, tattoos. So that's why you've seen that very sharp increase because they were targeting just that category of inspections. But I mean, it all needed done, so it's good. And all of our pools, we finished those for the season.
Just in time for them to be closed.
It's about. Actually, just recently we had a after action report with the city of Charlestown, the city of Branson, ESA, ourselves, JCCM, Red Cross, based on the Charles Tower incident. So finding out some of the, I wouldn't say that there were deficiencies in our communication aspects of it, but better preparing ourselves for the next, not if, but when, inevitable scenario of an emergency happening within the county that is a kind of an all hands on deck situation. Thankfully in that situation, no one was injured. But on top of that, our LAPC meeting, we're going strong. We have, there is some trainings coming up, they don't call it BLS, Stop the Bleed is, I think, what ESA calls the CPR trainings that are coming up as well. There is a train,
Tabletop next week.
Tabletop, there we go. Tabletop next week as well. So we've been kind of getting in the groove of things with the process of the things going on. We also have West Virginia Ready that's been doing some trainings as well. So that aspect, I know we're not going on here on the activities, but we've been fairly busy with certain things going on, which especially recent local and the state changing some of their stuff with like West Virginia Ready.
Clinical.
Did you guys get the updated
No.
paper? I
I don't know.
apologize somehow. Some of them
I'll make
was
sure
not
everybody
right.
gets to hear, just in case.
Oh, sorry about that. It's not negative.
Yeah, I had it already done.
Just want to make sure.
It's an updated one.
It's updated, there were some numbers missing, from the previous one that got through. Numbers in terms of our programs, vaccinations have gone up, of course, because of childhood vaccines, it's beginning of school year, so that's why we're seeing a surge. We have a lot, we've been working with the school, trying to make it more easier on these parents to get them scheduled for their kids' vaccines. We have immunization clinic tomorrow. We had set up 2, the second one is tomorrow on a Saturday. The last vaccine clinic we had was very well utilized. We were busy all day. This time, half of our hours are filled up so far. I do believe if there was more social media communication or texting from the schools, we would have gotten more people. So there's still work to be done in terms of trying to get the messaging across to families that these events that we have are available. We don't have any more planned so far, so we'll work with the school and see where we're at. I'm hoping by next week, all the kids will have their immunizations up to date with next week. Other than that, I wanted to share with you guys, we have 2 upcoming events. One is Save a Life Day, and it is on September 25th. This is the first year that all 50 states are actually participating in it. I have 2, so I would like you guys to let people know what's going on. And then October is upcoming Breast Cancer Awareness Month. And last year, you guys wanted us to let you know, so you guys can wear pink. So trying to get ahead of the game.
See if we actually do that.
I will send out a reminder.
Oh, okay, yes. Put it in big bold letters across our email.
With a picture of Dr. Reed pink shirt.
Yes.
You did the pink that one.
Yeah, we'll pick a gender.
I'll see what I start counting on it. I will see what I can do. Okay, that's all I'm gonna.
But yeah, just a reminder that it's Breast Cancer Awareness Month, October 10th. Here at the health department, we're gonna try to wear pink and jeans, and then donations are acceptable.
It's the 10th, right, is our next meeting?
Correct.
Putting a note in my calendar, wear pink.
And you're taking another picture of the staff,
Yes.
right?
Yeah.
Did last year. Take the forward.
Also, we are in the process of hiring an office assistant. We're doing interviews. We have several interviews scheduled for next week. We did 1 round of interviews, not quite there yet, so we're going to do another round to get the right person up there. So right now it's people are stepping in, including myself, to cover the front desk.
Thank you.
Health officer.
Would there be any objection if the county commission grabbed hold of these events and do a little publicity for you.
Well, by all means, especially to save a life day, that coming up as a very, very important day.
I don't want to steal your thunder,
No.
but what I would suggest is you take these wonderful posters and forward them to Eddie Benitez, ask her to put it in the package. And, Commissioner Heffestay will, recommends that these 2 days be made, special days for the county. So,
Thank you.
yeah, I mean, this is such good stuff. Y'all do such a good job. You should really get, more credit for what you do. Incidentally, I was on the radio and I said very nice things about you.
About me?
Yes.
Sweet.
I
Your money's in the mail.
cannot accept any. And I don't.
Well, if it's afterwards, it's
I don't
fine,
even
right?
But I do accept snow cones.
Snow cone. So I know somebody that has a snow cone connection. Yeah, that's very nice.
Snow things got wheels.
I know, right?
Traction on that train.
Yeah, I, just to give you a little background, I went on WRR and I got the interview because there was all the kerfuffle about the JCBA. And, I tried to simmer that down, but I also, bragged about the boards that I support and how none of them were problem children. And I said, what a great meeting you run. And I said some nice thing about Steve Allen, the LDPC people, Parks and Rec, and of course, the other one that, Historic Landmarks Commission. And I support the 250th anniversary of the revolution. Lori Wysong, who's our excellent director. So I actually got comments that I was being too positive.
I'd
I'd rather have that. But you all do a good job, really.
Just don't see that as a challenge to change that, okay?
Don't tell them.
No, it's great. There's a great team here working. It's made it, obviously, I think a lot easier for those of us on the board to do what we're supposed to be doing.
I could say something nice about Dr. Reedy.
They hadn't heard anything nice for a while. So we had a very good meeting yesterday with a lot of the leadership responders about the Charles Towers and about others. Very constructive, talking about, things to do for the next possible good insight.
Very informative. It was a good turnout. It was pretty widely represented. The mayor of Ransom was there, Mayor of Charlestown was there, police, fire. I mean, it was good. Dr. Reedy was there to keep us straight. And Steve Allen did a bunch of the talking. But that was really a nice meeting. Thank you for getting that invite to me. So
And thankfully, you chose out of your 3 possibilities of meetings yesterday.
I had 3 meetings all against each other, and I chose that one. And it was a pretty good choice, I thought. So one of the other meetings was covered by another commissioner, so I thought I could pass that one. The other was a 9/11 memorial get together. So anyway, thank you. And don't be afraid to call me on the phone for those last minute meetings, because I intend to show the flag of the county commission whenever I can, in a positive light.
As the secretary of the board, trying to get our replacement member, sent an email to the administrator asking if they get back on the agenda for the county commission. So you can help forward that request.
She will do that without any prompting from me. They usually have to post a notice for 30
I sent
days.
a note to one of your fellow commissioners as well to help.
Who?
What do you think?
So
No, I just
understand-
kind of was like, hey, where is this?
Oh.
Not, yeah, I didn't want to.
Our understanding is that there
Oh,
was
you can bother me. I like being
So-
bothered by Board of Health people in a positive place, because I want you to be.
This was more of a negative of like,
Okay, what in the hell?
yeah.
Our understanding was that several people we think we're eligible to apply.
Uh-huh.
But I don't know that. I don't, if they say, oh yeah, we sent it in, I don't know if they actually did or they fall out of the jurisdiction for some reason or the other. I don't have that information, but,
Just for clarification purposes, because there is some misunderstanding. But when we have openings on boards and the stuff is sent in, the county commissioners review the applications, and it's usually a cover letter and a resume. We look at it and then we nominate people, and the people we nominate are the people that are brought in for the interviews. So just sending in an application doesn't get you FaceTime before the county commission. And of course, if you want to actually be appointed, you better doggone show up for the interview, because that's a kiss of death if you don't show up. That's
Either
unless-
virtually or in person. I mean, I know in cases, people have gotten 48 hours notice to show up, and that's, I don't think fair.
but if they don't do either,
Yeah, but
that-
you're
yeah.
saying either is.
best to show up in person.
Sure.
Especially if it's a competitive
Mhm.
position. But it virtually, so JCBA, Joe Upson applied and she was online
Right,
for the
yeah.
interview. Like she wasn't going to get appointed,
Mhm.
but because she's very, very highly qualified
Mhm.
person, I'm glad to have her on board. But anybody that's interested, tell them that in addition to the cover letter, resume, it's very, very good for them to show up, and usually the times on the agenda for the interviews are fairly close.
Mhm.
We try to put them earlier in the meeting so that they don't wind up being
Drag out.
at midnight or something like that, so.
so the process isn't clear from the public is, that it's still open what's happening. Because, there were announcements before, but not currently, so. Need to be sending word out on Facebook or something saying, if you're interested, apply, but I don't want to do that.
I think there's applications in, so I think we've sort of settled that.
Well, that's good.
So. What else you have?
I cannot have much more, we have flu vaccine in now, right?
We have what?
Flu vaccine,
Flu vaccine.
we have it in here for
Okay.
people to get, yes. Yeah.
I know it's on the way.
Yeah, so that has come and we believe COVID vaccine is on the way.
No, what else is on? Well,
The COVID vaccine is already in the possession of the major pharmacy chains. But the pharmacists are not allowed to give it in West Virginia and several other states, not because of COVID specifically, but because they can only give vaccines approved by the one committee of the CDC, which doesn't meet to discuss this until next Friday, I think. So they can't give it.
Meaning like they can't administer it or
They can't
stop
administer it because it's not yet, this version of it has not yet been approved by the CDC committee. And the pharmaceutical law just says they can administer anyone that's approved by that committee. So several other states have the same thing. I don't think it's a bad law, it's just that it's a little different this year.
Just as a point of order, last year when I was offered the flu vaccine, I didn't take it. And this past year is the first year in 20 years where I've gotten the flu. So I'm back in the saddle for getting the flu vaccine, so. And if you, that's just personal,
It doesn't eliminate the flu, but it decreases the number of people that get serious illness, especially for those of us. If we get serious illness or injuries or anything else, we don't handle it as well as when we were perfectly healthy 17-year-olds.
Thanks. Okay. Great.
Then we talked a little bit about a lot of the things that I was going to discuss, but with the, one of the important things I wanted to talk about was the FY25 audit. We kind of pointed that. The contractor has actually reached out to Consolidated Young and sales. They're ready to go with it. We're hoping to have that scheduled to be done either the end of October, beginning of November. So, they're already chosen everything else, all that fun stuff there, now that we're getting the ball rolling. So, I assume like, much like last time, it will be a, virtual, audit. So we should have it back hopefully December. At worst case scenario, beginning of the year, but calendar year. Worst case scenario, soon. Timeline. Again, touched, Save Life Day coming up, September 25th. We are all going to be at different locations throughout the county. It is a wonderful, wonderful event. It is one of those that is the first time that this has been all across the entire 50 states. It is a very important topic to me personally, just due to, drug overdoses, young people, family members, friends. So it is a pretty big topic for me, and I always want to push this out. It's a great, Narcan is an amazing thing that I can take it right now and won't do anything, but my father, who's on medication, may forget that he's already taken it, may need it, right? It's not just for, what some people like to stereotype about. So please, everybody come out for that. They can't spread that around. I think we touched the process of hiring an OA, process of hiring a secretary to fill Alyssa's position. The OA is to really, we need another OA. There's no two ways about that one. We do have a conference coming up next week at Oval Bay Park. That be the Public Health Accreditation Board, something or another. There's a lot of.
So
Yeah.
you don't want to say the word accreditation. That's a bad word.
Sorry. There's an A in there somewhere. It's one of those words. So that's pretty much the week long. We'll have the administrative meetings along with that. That will probably discuss a little more about PIA, things of that nature. We did get notice this morning that the QRT grant funding opportunity is out, so we will be applying for that. We are working with QuickBooks Online. We have QuickBooks Online getting it rolled out and adjusted. That will now actually help on a multitude of levels. One, it would actually be fiscally cheaper for us and we have more access, easier access to do our things that we need to do. And it would also allow Cops Holiday Young to be able to see us, see our stuff easier because they can virtually see it. It's a win all around for everybody. New payroll system. We had the fair system up, or previously, that was a big turnout. We've been busy. The summer comes, we've been busy. We've been doing a lot of stuff. Again, vaccine clinic coming up. We've been hitting all cylinders and
It's great.
and running red on it. So, but it's been fun. I think the team has been amazing. Everybody has helped out. Everybody has covered down. I can't speak highly enough of this organization and the team that we have here on how they operate and operate with covering down with each other in situations that we need. So I couldn't be more proud.
Great.
And that's it for me. Like I said, thanks. What?
Go ahead and end it.
I would just recommend that maybe at our next meeting, we have a group photo.
Well, yeah, we'll be wearing pink.
For publicity.
Oh, that's right.
We'll be wearing pink.
That's right.
The stakes have been raised.
Who's gonna show black?
With a pink tie.
You already put it on the calendar.
I put it on my calendar now, whether or not
I don't have a lot of pink photos.
I have
You gotta put it in-
I do have a shirt that from a distance will look pink.
Actually, I was four pink.
Beautiful pink suits.
Pink suit?
I have a. Oh,
Well, I started on the camera. Oh, okay.
All right, going into the next meeting, so before we adjourn, do we want to schedule a special on October 20th? That gets us through the public comment period for your food handler stuff, just so we have it on our calendars and it'll be virtual.
You change the time of this meeting, the next meeting?
No.
Okay.
I apologize.
I have a very orderly schedule. Okay.
Yeah, we're lucky that she's this time zone running.
Yeah, exactly, like you're pushing it, man.
So the 20th looks good.
You said this one.
I'm looking here, the 20th, if you guys wanna do, I don't know if earlier, it's easier for you to do like an 8:30 or 9 o'clock. I think this should be all of a 10-minute thing. Cause all we have to do is public comment consideration.
Make it least convenient for the public, if that's what it's about.
No, that's what I was want to ask, is it would be considered like a closed session or to
No.
discuss?
No.
Okay, no, I just wanted to verify.
What time zone we,
That's a great question. I don't even know. I might have to be in Texas that weekend, so. I'm trying to avoid it right now, but. So if I know that we have this, then I can schedule flights accordingly, so I do this and get
I mean, I think.
Yes,
8:30
that's
is
good with
fine.
me.
8:30 or 9. I mean, 9 o'clock's fine if you think 8:30 is not appropriate for the
That's-
public. I'd like their lives if 8:30 is too early, but okay. I don't know. I'm
I
looking
mean,
at us
if
working.
we
for
want to keep it
professionals.
very similar on schedule and on brand for the meetings, then 9 o'clock would be.
9 o'clock,
I'm fine with that.
It's fine.
Yeah.
9 o'clock.
And it allows people to deal with some urban morning traffic.
Well, I was gonna say, like, if you're commuting, like, again, it's gonna be virtual, so.
we'll offer the option if someone wants to come in if they don't have, can have.
I think we can say virtual only. There's no prohibition to that. It just has to be open to the public and noticed appropriately, so please make sure the notices go out. Quite frankly, you can put it out tomorrow or Monday and
Yeah,
you're
when-
well in
and-
advance.
I think that's when we put out public comment, we'll put out everything. With that, hey, this is when it's going to be, please, All right,
Perfect.
I'm just gonna put it in my calendar so I don't forget.
Question, back to these wonderful posters.
Sense.
Can you send soft copies to Eddie Benitez and CC me
Yes,
and ask that they be included in the package?
yes,
Upcoming package, and I'll turn in an agenda request. I think yesterday noon was the deadline for the next meeting. I don't have my calendar in front of me.
yeah, I can definitely though send it in to you and to Eddie and then have you CC'd on it.
Yeah,
Those are too easy.
and yeah, because I would like to give this as much publicity as possible.
I appreciate that.
It could be on their website even if it doesn't. really-
Yeah, if they put it up on the Facebook page, that would be good. If we miss the deadline for the September 25th. What is the next Jefferson County Commission meeting? It's about I think it's next week,
I think it's week.
next Thursday.
Or
They're all kind of running together.
So that's the Save a Life Day.
I used to pride myself in is you give me a date and I could remember what went on at that meeting, and I'm getting to the point now where it's a lot of clusters. So.
All right. You guys got that all sorted? Okay, all right, motion to adjourn?
I move we adjourn.
Second.
Any discussion? All right, all those in favor say aye.
Aye.
Thank you, guys.